Hi, I'm Joe Hannon from Team Juggernaut AI. I'm a powerlifter as well as a personal trainer here in New York City.
How's it going? My name is Dr. Clinton Lee. I am a physical therapist, also with Team Juggernaut, and I work with a lot of competitive powerlifters and trying to rehab their injuries. And today we're gonna look at Joe's hip and try to troubleshoot some issues that's going on with his squat. Joe and I decided to work together when I discovered that he had some hip pain that was kind of troubling his squat performance. So Joe's just gonna take a minute to talk a little bit about some of the symptoms he's been experiencing. And yeah, take it away, Joe.
So I'd say now going on 7 or 8 years, a long time. I've had some pain in my hip, kind of the bony area here. And whenever I squat down, that pain kind of shoots down my leg, comes a little bit back up my quads. It's been something that comes and goes. Some days is awful, some days I don't feel it at all. I've never gotten it treated. Unfortunately, I'm just a very stubborn athlete. I've just dealt with it. And I've done some decent squatting numbers with this pain. However, I know I could be much better given my strength in the deadlift, which is still strong hips, strong knees, strong quads. So I know my squat could be much better if I didn't deal with this pain, especially in the bottom of that squat.
So what we're gonna do today is we're gonna look at a couple of movements to kind of give us some more information about what could be limiting Joe's squat. We'll run through a couple of tests and we'll try to hone in on what specifically is bothering him. And we'll go through some corrective exercises as well to see if we can address the pain and hopefully get his squat to be a little bit more comfortable and that he can start improving his performance on that end too, to match his strong deadlift and strong bench. So Joe, why don't we start off with this? I'm gonna ask you to bring your feet together like so, and I'm gonna ask you to put your hands in front of each other like this. I'd like for you to bend down and try to touch your toes.
I am the least flexible man you'll meet.
All right, well, just as much as you
keep my knees straight.
With your knees locked, please.
It's gonna look bad.
Yeah, that's all right.
And there we go.
All right, that's all right.
There it is.
Okay, good. And you can come all the way back up. So does that produce any pain in your hip though?
None at all.
No?
Just
Okay.
a big stretch of my hamstrings.
All right, okay. That's something we can work on later. But today we're going to focus specifically on things that reproduce the pain that you just described in that aspect of your hip. So it's good that that's okay. Go ahead and turn and face this way. And I'd like for you to place both of your hands on your lower back like so. I just want you to do a back extension like this.
Feet together again, or just
feet close together, make them touch as they were before. And just go ahead and bend back once for me, as far as you can comfortably go.
There we go.
Okay. And relax. So once again, any discomfort being reproduced in that aspect of your hip that you were complaining about? No? Okay. Okay. Let's jump into a bodyweight squat. I'd like for you to squat with your hands on your chest. You can put your feet and your toe out angle in whatever you feel is most comfortable. So maybe ideally just kind of mimic your competition squat stance. And I just want you to do one squat as you would normally do like your competition
So
squat.
no pause at the bottom, anything, just squat up and down.
Right, that's correct.
Hit depth, the idea, I guess, at least.
Yeah, that's right.
All right, so here, like this?
That's right, yep.
Actually, my elbow's gonna get in my way. I guess. I'm trying to get my elbows out of the way of my legs, but that was pretty much it. If you're gonna ask no pain, there wasn't much pain there, to be honest.
All right.
But again, I told you it does come and go. So
I see, yeah. So would you say that the load on the bar
makes a difference?
Makes a huge difference, right?
100%.
Okay, okay.
But there are days, and I will say, standing up from just a seated position hurts like hell. There are days that can happen. So I can't always promise that pain is going to be there. But I could do it probably easy like this. But either way, like this, that feels okay right now.
Okay, okay. And if you find that you do many squats in a given day, will you find that the tendency of your pain to increase? Will you find that to happen?
So volume through the day as well as through the week does tend to make it worse.
Okay, okay.
So I'm actually better, even though I know squat volume can help in powerlifting.
Sure.
For me, just because it reduces the pain, I tend to try to keep it a little lower.
Okay, okay. So what that tells me is that there is a dosage issue here. Obviously, one bodyweight squat for 1 rep is not really going to reproduce Joe's pain. But we know that sitting for prolonged periods, increasing the volume, squatting at a certain intensity is going to reproduce these symptoms. The art of rehab is figuring out what dosage, what volume, what intensity, what ranges of motion can Joe squat at, where we can kind of get a training effect, but also not be so aggravating that we kind of perpetuate his pain and make things more irritated. So why don't we do a couple of more tests on the table. Actually, we'll do one more standing one before we go on the table. I'd like for you, Joe, to go ahead and stand on your left leg, and I'd like for you to try to hold that for 30 seconds. We want a little bit of a knee bend and a little bit of a hip bend too. So in other words, I'd like for you to stand like so for about 30 seconds, okay? And then I want you to tell me the symptoms as you do that. Ready, you're on, 30 seconds.
So other than the symptom of balance, it doesn't feel too bad.
Okay. About 15 seconds more. Now, deepen your hip hinge a little bit and give me a little more depth if you can. Now, what do you feel in your hip, in your quad?
So I'm starting to feel some of that reproduced pain here and a little bit more here.
Okay, okay.
I think that hip does tend to get a little worse as I go deeper.
I see. Okay, and you can relax. Okay. So once again, the pain wasn't tremendous.
Wasn't severe.
Okay,
no.
okay. But out of everything that we've done so far, would you say that this is something that
worst?
Most reproduces your pain, even if it's in a small degree?
Yep.
Okay, okay. Now, Joe, just to get some more idea about the precise location of your pain, if there's a precise location, it's okay if it's kind of a more general, diffuse kind of location. I'm just going to do some palpation over your greater trochanter and the surrounding tissues. Now, as I kind of prod into this aspect of your hip, what are you feeling?
Higher, not so much. When you got slightly lower than it,
Yep.
more in that area,
Okay.
I start to feel it.
Okay.
Again, like I said, I don't know why I've been fortunate for these past few training weeks. The pain has not been as significant as it used to be.
Okay, okay.
But again, I can't, I get worried with that because I don't want to, I know it can come back at any day.
Yeah, I see. So even though this is a long-term chronic issue, in recent weeks, it sounds like the load management has been good and it's not really aggravating you too much. Excellent, good. So the programming on your Juggernaut AI app has been...
Seems to be okay so
hitting
far.
The money. All right, awesome, good. So I'm gonna ask you to straighten out your left leg. I'm gonna put you in a little bit more side lying, okay? I'd like for you to lift your left leg up towards the ceiling, right about there. Any pain or discomfort reproduced in that aspect of your hip?
Nope, just feels weak.
All right, and I'm going to push down and I want you to resist me, okay? Ready, set, go. All right. So what do you feel there? Before you said you felt a little bit of weakness.
It just feels weak.
Okay.
It didn't hurt, thankfully, but it feels weak.
Okay, good. So there's no pain in that aspect of the hip, but you said it felt a little bit weak, right? Mm-hmm. Okay. Why don't we just test the other side as well? So straighten out this leg. I'm going to put you in a little more side lying. Good. All right, go ahead and lift that leg up like so. I'm just going to put you a little bit more into this position here. Okay. So I'm going to push down and I'm going to ask you to resist me, okay? Ready, set, go. Okay, good. Now, how did this side feel compared to the left side?
Definitely stronger.
Okay.
Again, I don't want to use the word pain.
Yeah.
But I felt more going on in this leg, if that makes sense.
Yeah, so there was some more discomfort, would you say, awareness upon the left side that you're not quite perceiving on this side, correct? Mm-hmm. Okay, okay. And historically, what have your symptoms been on this side compared to the left side? Are they kind of like...
So left side's always been very bad. Occasionally the right side will get that feeling, but I always attribute that to the right side kind of taking over more work, so it's more just an overuse.
I see.
Because my hips and the bottom of the squat will, I will shift. I think just for a pain management situation, my body just probably does it on purpose.
Yeah.
I will say, as I lay here longer on my side, it does start to hurt the hip.
Okay.
So just the pressing coming into this, which is why even on in my bed, I can't lay on my side for too long.
I see.
Even without a cushion, it'll start hurting.
Okay. So based on Joe's symptoms, it sounds like his symptoms are consistent with something that historically has been called Trochanteric Bursitis. That diagnosis name has more recently been changed to Greater Trochanteric Pain Syndrome because research has shown that it's not really this inflammatory process that's causing Joe's pain, but that it's more a function of gluteal tendinopathy. The greater trochanter is a bony prominence on the lateral femur where the gluteus medius and the gluteus minimus tendons attach. So again, lots of research has shown that pain in this aspect of the hip has more to do with tendon issues to those muscles, among some other things. But those are largely the sources of problems for people with this condition.
Now, would that be weakness, or what would be a reason for that? Just like why is the glute causing that issue potentially? Is that just a weak glute need?
Not necessarily. So it depends on, sometimes it can be weakness. Sometimes people whose training routines are missing a certain aspect of training that targets the glutes can lead to a little bit of, I wouldn't even use the word like atrophy, but I will say like disuse or not enough loading to those.
So like I'm overtraining the glute max and undertraining the glute medius type thing.
Maybe, not necessarily. Like okay. I'm not sure how specific muscles are getting attention versus the others, but for whatever reason, these muscles are the ones that could use a little bit more attention in order to alleviate the symptoms going into your hip and also kind of transferring into the front part of your thigh here, okay? Something interesting about Joe's case also is you may have noticed that a lot of the diagnostic tests and assessments that we did, they weren't super aggravating to you, right, Joe? You felt maybe a little bit of discomfort here and there, but it was never really anything super debilitating or acutely painful.
Right.
And I think this is the tricky nature of certain chronic conditions. And Joe, why don't you tell us a little bit about historically when the weights get heavier on your training program, as they will with squats in a couple of weeks, historically, what has been your experience when the weight goes up and how your pain has responded to that?
So when I've squatted, especially either in a hypertrophy phase where it's, we could say 5 sets of 8 or something of that volume, or when I'm getting now towards the back end of the strength phase and the peaking phase where the weight is really starting to jack up, that's when the pain tends to get a little worse. So I think that goes back to what we were saying where volume and the weight kind of exacerbate the issues going on more. So lately my squat weight has been relatively well under what I could normally do. I did just hit a 505 pound squat for 3, and after that day that pain had been a little worse. I'm thinking now going into that peaking block there's a potential of more of those high-end weights, which gives me a little hesitation because I think that could start exacerbating it. Like I said, right now, no wood for me to knock on, but figuratively knock on wood.
Oh my gosh.
Yeah, there we go. Things have been okay, and I like that. I think I was explaining to you earlier too, I don't know if it also has something to do with, I used to be what we would call in our sport or weightlifting an ass to grass squatter. So I used to squat very deep, and it's just something I had learned and always kept in my training. And lately I've been squatting to more of a powerlifting depth, which is just slightly under parallel. And I'm thinking that also might be helping manage the pain to a degree. Again, these are just guesses, just hypotheticals, but I'm using that based on also not hurting so much right now, thankfully.
Yeah. No, I think that makes a lot of sense, right? Like you're training in volumes and intensities and in ranges of motion that allow you to continue to work on your performance, but at the same time, don't exacerbate your pain. And it allows you to train for longer periods of time that way. And you bring up a good point about kind of addressing this now and being preemptive with our physical therapy interventions. A lot of time people think rehab and physical therapy are things that not everyone necessarily needs. And I think sometimes even if someone isn't experiencing acute, like debilitating pain as you are not, I think it's still good to address certain things that could potentially be issues later on, so that you are able to kind of tolerate those heavier intensities when the time comes, when you hit that peaking phase. So I think what I'd like for us to go through now is let's go through some exercises that can help target those gluteal muscles that we mentioned before, and just kind of build a little bit more work capacity and load tolerance in those structures, so that when you go back to squatting and when you put more weight on the bar, that you won't experience these, or you'll at least experience less discomfort that impacts your performance. So, sounds good?
Sure, yeah.
All right. So this first exercise I'm going to ask you to do is it's an isometric exercise for the muscles on the outside of your hip. So I'm going to ask you to stand close to the wall here. Okay. And I'd like for you to lift your inside leg up like so and press it against the wall. And let me see you squat a little bit on that knee. Good. And hinge forward a little bit. Okay. And now in this position, I'd like for you to push this leg as hard as you can into the wall. Now, as you do that, you should feel your gluteus medius here and maybe a little bit of your quad contract at the same time, okay? So the purpose of this is really just to kind of put some force through these structures in a way that kind of almost gets at the pain, but also at the same time respects the pain and works within your comfort tolerance, okay? So I want you to hold that for another 15 seconds. And as you're doing this, tell me what you're tell me what you're feeling and what you're experiencing.
When I initially got into it, I felt the pain kind of coming through here. As I hold it longer, it's kind of dissipating, but I don't know if it's just because this is getting tiring.
Yeah.
So my body's feeling now this being tired as well as that glute being tired.
All right, all right.
I'm not sure, but I feel it less. I feel it more in my ass right now.
All right.
This is hurting.
All right, good, good. And that's probably more than 15 seconds, so you can relax there. So that exercise is an example of an entry-level exercise that I would give to someone who's probably experiencing more acute or reactive pain, or someone who has very sensitive symptoms. It seems like Joe's symptoms weren't that flared up, and that he was tolerating this exercise pretty well. I don't want to speak for Joe, but
you're right. Like I said, it's just my butt was tired.
Yeah, so a little bit of fatigue, that's good. But for Joe, like, we'll probably give Joe something a little bit more challenging, where we're almost getting into that pain territory, but also backing away from it at the same time, just so that we can kind of challenge those muscles a little more with a little more difficulty. So for this next exercise, I'll just demonstrate it, and then I'm going to ask you to do the same. This is a body weight clamshell. So I'm going to ask you to lie on your side with your hips and your knees flexed like so, and I'm propped up on my elbow like this. From this position, I'm going to come up like so and kind of open up my knees, and then come all the way back down. Okay.
And the leg on the bottom, is that the weak leg, or the leg on top is the leg that should be experiencing the pain?
Yeah, so in your case, the left leg is going to be on the bottom. The symptomatic one will be on the bottom here. Okay, so you're going to try to get as high as you comfortably can. Pause that top position for about 1 second, and then continue. Okay. All right, let's give that a shot.
So I'm starting with the hip down, and as I come up, this leg is just lifting that hip into that position, correct?
That's right. So your bottom leg will remain on the ground, but your hip is going to come off. Does that make sense? So
it's kind of just the knee pushing it down.
Right, that's correct.
Okay. So let me see if I get this right the first try.
That's it.
And then back down.
Back down, that's right.
Keep going.
Yeah, give me like 10 of these.
And hold that top position, right?
That's right. So you've got 8 more. So as Joe does this bodyweight clamshell, you can see how the hip abductors, mostly on the left side, and a little bit of hip external rotation too, are causing his body to come up off of the ground. So this is a great way to strengthen the muscles, or to load the muscles on that aspect of the hip. And at the same time, we're probably getting a little bit of some core strengthening too, because that top position is kind of like a side plank.
So I do have some input, but it's actually not when I'm in this loaded position. when I come down here and the pressure from the mat pushing in, it's actually starting to be a little more sensitive to the hip.
I see.
So that bony protrusion area.
Yeah, yeah. So a little bit of direct pressure on that greater trochanter is kind of reproducing your symptoms a little bit.
Come down to this position.
Yeah, and that's a very characteristic sign of this condition too, of this greater trochanteric pain syndrome. As Joe finished up these last couple of reps, something that I'll say about pain management is when someone with this condition sleeps, it's good to try to avoid direct pressure if possible on that aspect of the hip. So in Joe's case, I would ask him to either sleep on his right side to avoid pressure on that left side, and to also put some pillows underneath his knees to prevent excessive adduction of that left hip when he's sleeping on his right side. So what that does, it prevents like excessive lengthening of those structures, and it might lead to a little bit of some more comfort during sleep.
Would a body pillow kind of act the same?
Yeah, like that's the kind that just kind of you're hugging and like kind of spooning a big pillow.
Yeah,
Yeah,
sure.
yeah.
I've thought about it. I've never got one, but I know they also create those pillows that kind of have like you can.
It's like an S-shaped type
thing.
thing.
Yeah, designed to be between your legs, I guess. Right?
Okay, yeah.
But is that just to keep them in like this position to help? Like.
Right. So in this case, if you had let's say your right hip was the painful one, putting a little bit of a wedge in between here will prevent like excessive adduction, and it might help alleviate some of the stress here. So looks like this exercise is a little bit more appropriate for Joe than the isometric one. The isometric one, once again, I'll probably give that to someone with very reactive symptoms. This is a little bit more of a difficult exercise. It's challenging Joe a little bit, but you know, since the pain was still kind of like under control and he was able to tolerate very well, why don't we look at another more challenging exercise to kind of give to Joe over here. All right, so Joe and I have come up to the upper floor of the gym here where we have access to the reverse hyper. We're gonna do a hip abduction exercise on the reverse hyper here. So Joe, I'm gonna ask you to climb up onto the reverse hyper, but in a side-lying position so that you are facing that wall.
Okay.
All right. And now I'm gonna strap this around like so. All right. Now, Joe, I'm gonna ask you to like stabilize yourself on top of the platform here. Okay. And with your left leg, I'd like for you to lift this weight up slowly and back down slowly. That's it. Give me a set of 8 reps. So as you can see, Joe is abducting his left leg against resistance here. We're challenging the gluteus medius, the tensor fascia lata, or the TFL for short. Basically the hip abductors of the hip here. And like I mentioned before, we're trying to increase the load tolerance of these structures and also just increase their strength too, so that he can tolerate that aggravating position when he's down in that squat. How you doing so far, Joe?
Feels good. In the more stretched position, I feel the pain, but in the flexed position or contracted position, I don't feel it, just tiring.
Oh, okay, gotcha. So we'll talk about that in a little bit. So why don't you, that's good, Joe. Why don't you come down from there? I'll unhook you from this. Okay. So Joe brings up a good point about, that I wanted to make about experiencing pain during rehabbing certain exercises. Is pain okay to work through? Is there good pain? Is there bad pain? And how do we progress when we experience it? So Joe experienced pain in the bottom position of that movement. And from a scale of 0 to 10, 10 being the worst pain, how much would you put a number on that pain?
Subjectively, I'd probably say within a 3, 4 at most, but 3 is probably much more accurate.
Okay. And then ordinarily, like how much would you say your pain is like at rest? So just like normally, just kind
of. We're talking about like right now.
Yeah.
Right now I'm good.
Okay, so right now at rest it's a 0, right? So when working with tendinopathy, such as what Joe might have in his hip, it's important for the pain to return to the baseline at least 24 hours or within 24 hours after completing the exercise. So a little bit of that 3 to 4 out of 10 pain that Joe's experiencing is okay during the duration of the exercise itself. And it seems like as soon as you cease the exercise, the pain is back to 0. Okay, so in which case, this is an okay amount of pain to kind of to work through during rehab. Everybody has a different subjective pain scale, so it's going to be different from person to person. So that may need to be individualized depending on the person, their training history, and their sensitivities. So that's something important to keep in mind. But for Joe, I think this is the most appropriate exercise given the other exercise that we did. This seems to challenge him the most, and it allows us to load his hip in a way that's going to be challenging and should be very conducive to his rehab program.
I have a question.
Yes.
Not all gyms, thankfully both of mine have a reverse hyper. If you are without, what would be the best exercise to mimic something of this nature?
Yeah, that's a good question. I know ankle weights are probably not the most popular item that gyms have or that people have like at home. But if there's some way to have this progressive resistance that we can gradually put on more and more load over time, that's going to be our kind of key to success here. This is very unconventional, but if someone simply has a backpack, right? Let's say they're at home and you put some books in a backpack and then you lie in your bed and then you lift that up. That's one way of adding weight to an exercise that allows you to challenge.
And you do need to be raised up, right, to have that full stretch and full contraction position, correct?
Right. So you need some sort of elevated surface so that you get that full range of motion. Now that you mention it, if you're lying on your side and you're like level on the ground, you probably still can get some benefit because that's technically still hip abduction.
Right.
But the reason why I like this is because you get that little stretch at the bottom end of the movement, and you can probably challenge through a slightly greater range of motion. So it's not essential, but it's
well, for us, the reason why I was asking, because I know what we were just talking about, that's where I felt the pain most, and I didn't know if reproducing that kind of aspect was pertinent to what we're doing, because on the lying down I wouldn't feel that because obviously I don't have that same stretch, so I don't know if that matters.
No, that's a great point. Like let's say you did a hip abduction exercise where you never really reproduce your pain. I'm not sure how relevant that exercise might be for you, where it's something that doesn't really get into your problem point. So that's a really great point that you bring up about you want to gently poke into the pain territory, but at the same time respect it at the same time. So that's a great point about like. So
you want to feel the pain. To a degree,
to a certain
want
extent,
to feel it.
Right. We want to lean into the pain a little bit. Is like how I like to kind of describe it. So we don't want to fear pain, but we have to respect it at the same time. If that makes sense. Yeah. Great question.
All right. I want to thank Clinton here. He gave a lot of information, a lot of stuff that can hopefully help with the hip issues that I've had now, like I said, for 8+ years. I learned quite a few exercises that I was not using before, mainly things that really involved abduction, correct? So kind of working on the glute medius. What other muscles would you say the glute minimus was?
Gluteus minimus, gluteus medius, maybe a little TFL.
But all those things, they were tiring. Holy crap, just something so simple. I can tell that I probably do need a lot more work in general, because a lot of what I do is in a sagittal plane. Those you consider the frontal plane, correct? So I need a lot more work in that area. I think actually many powerlifters could benefit from just frontal plane movements as a general thing. And knowing being weak in that area, I think it can just carry over to any of my lifts, deadlift, squat, whatever. But as long as I can minimize that pain, more importantly, I appreciate it. You gave me a lot of helpful stuff to do, and I will definitely carry that over towards home workouts, even warm-ups. Could I do it for a warm-up?
Yeah,
would it work that way?
For sure. Some of the bodyweight ones I think would be great warm-ups.
Okay, would you do it as a warm-up or after exercise? What's more important, or does it matter?
Yeah, so for the more challenging exercises, like the one that we just did with the reverse hyper, I would treat that kind of like an accessory at the end of like your main training.
Okay, cool. All right. But yeah, thank you. It was hugely helpful.
Yeah, no, the pleasure's mine. Thank you for coming through and offering your body, for allowing us to explore things and to figure out what's going on with your hip. And hopefully you'll be able to progress from this and continue to put numbers onto your total. If anybody that's watching this has issues that are similar to what Joe and I talked about today, or anything that they feel like is impacting their powerlifting performance, please feel free to come see me at Physio Strength. I'm located inside Squats and Science in Williamsburg. And yeah, that's basically it. Thank you for watching. If you want to see more content like this in the future, make sure you subscribe to the channel, and we'll see you soon.